My name is Dr. Maria Story. I am a kidney and blood pressure specialist at Southeast Iowa Regional Medical Center. Everyone knows about heart disease and the importance of taking care of your heart health and about preventing cancer, but kidneys tend to be a forgotten organ. Kidneys have a really important role in the body. They do two very essential things. The first is that all the food and the liquids that we take in, kidneys regulate the amount of liquid in our body so we don't develop swelling. The second really important role is that as we're eating and drinking and going about our daily lives, natural toxins and metabolism byproducts are produced, and the kidneys clean the blood and remove the toxins from the body. If these functions aren't working very well, either in terms of fluid removal or in terms of toxin removal, people develop kidney disease and eventually can lead to dialysis and kidney failure, and sometimes kidney transplantation, which are obviously very serious problems that most people would like to avoid. Protecting kidneys is important. The most common diseases in the United States that lead to kidney failure are high blood pressure, diabetes, and using too many medications in the NSAID category, which are things like ibuprofen, Aleve, naproxen, meloxicam, and other over-the-counter anti-inflammatory medications. In terms of high blood pressure, make sure you're getting your blood pressure checked regularly at your primary care office. And if your blood pressure is high, it should be treated to a goal of around 120/80. If you do have diabetes, make sure that your diabetes is under good control, ideally with an A1C around 7%. It's really important to also manage these chronic diseases with lifestyle changes, including regular aerobic exercise and also diet. I can't emphasize how important it is to eat a healthy diet. Food really is medicine. Kidney disease is usually asymptomatic until it's very advanced and often at that time not reversible. The way to get checked for kidney disease is with regular appointments with your primary care provider. And your primary care provider will do two tests on you. One is a blood test to look at your creatinine levels in the blood. Using the creatinine level, the computer will do some math to calculate your GFR, which is basically your percentage of kidney function. If that percent kidney function is down, that's a clue to your primary care provider that something may be off with your kidneys. The other important test is called the urine albumin to creatinine ratio. This is a test that looks at protein levels in the urine. If people have very high amounts of protein in the urine, this is a sign of kidney stress and kidney damage. Both low kidney function using the GFR number and the protein in the urine being high are signs of kidney disease and should be evaluated further. With healthy lifestyle changes, including having a normal weight, exercising regularly, and eating a diet that's full of fresh fruits and vegetables. If you have chronic health conditions, work with your primary care provider to manage those conditions as best as possible. Kidney disease can be managed and treated, and it is possible to avoid kidney failure and dialysis.